Hi, I'm really pleased to join you today and to share with you this progress report for the PPI Ignite office here at Trinity College Dublin. On behalf of Mary McCarran, Michael Foley, and myself, I hope this presentation is useful and provides a good overview of activities. Just as a reminder, the Ignite office is a pilot project funded by the Health Research Board, Irish Research Council, with the primary objectives of building capacity for PPI within health research by broadening the group of researchers who are engaging and involving members of the public, and then aiming to improve the quality of those approaches. We have 17 partners within our partner council, and in some instances, we've worked really closely over the past few years on co-created research projects and proposals and developing infrastructure to support PPI activities. We've really left it up to the partners to identify where we can provide supports, whether that's through a funding mechanism or an in-kind service donation, or whether it's through some sort of technical assistance. Just as a reminder, we had committed to this work program to advance those objectives. So we knew that there was going to be some component of training workshops, networking events, proposal development support, and face-to-face clinics that were going to be necessary if we were to advance public patient involvement in health research. We set out some modest but achievable targets, feeling that we wanted to focus in on engaging with researchers and our partners to fundamentally understand the needs and then begin to address them. So in each of those instances, we've exceeded the targets that we set for ourselves, which is wonderful. And we're particularly pleased that the conversion of funding proposals which advance public patient involvement has been high. So, we are seeing both the result of these activities in terms of proposals going out the door, but then we're also seeing the translation of those into actual projects that are now up and getting up off the ground, and also need some support in terms of actioning some of those strategies. So it's been a really nice process to witness and to be a part of. Just quickly, within our training workshops, we've reached more than 700 researchers across all of the universities, and those research topics have focused in on, impact, planning for impact, advancing public patient involvement, forming young person advisory groups, and a host of other topics that were requested by researchers. We've advanced a few networking events, and this is a nice example with one of our partners, Access Earth, where we brought them together with our graduate student union during their induction week. Obviously, this is pre-COVID, but the idea was that as new students came to college and they began to learn about Trinity and the surrounding community, we could advance a crowd-sourced citizen science project in which we mapped accessibility around Trinity and the Dublin area. As students got to know one another and the region, they could engage in this activity and have a pizza party. So, nice opportunities to bring diverse stakeholders together for mutual benefit. We've worked with a number of teams on small projects like funding proposals for events, but then we've watched those translate and transform into fully blown research projects, because in some instances it was just around building a network, engaging with patients and members of the public to identify research priorities, and then to advance those co-created research projects. So as we've done the training and networking events, we find the next logical step is that researchers want some face-to-face clinics or specific proposal and project development supports. And as we can, we've been delivering those. We've also looked at opportunities to embed public patient involvement strategically within our research charter and strategy, within our faculty metrics, within health sciences, and then looking at award criteria and our research support system in terms of how we can begin to track and identify this information and celebrate, good work. Over the past few years, we've worked with partners on publications, so a series of policy briefs around why public patient involvement aka engaged research matters, and how we can advance that through enabling policies and processes, whether you're within a higher education institution, within a funding agency, or working for government. And while we'll celebrate the PPI toolkit with the Health Research Charities Ireland in 2020, because that's when it was launched, certainly in 2019, we worked on the proposal to get that project funded and then on the process for its development. So these things, as you know, take time, and it's good to reflect on them as we're doing these progress reports. Well, we hadn't necessarily set out to work with researchers on award supports. It became evident as we got to know them better and develop case studies and some researcher profiles that we had really great exemplars to celebrate. And so we've worked with, undergraduates to help them with funded PhD projects, all the way up to working with Professor Mary McCarran as that exemplar of impact with the Health Research Board. So just effectively helping great people tell their stories a little bit better. And that's been a real privilege to be involved with. Up on the screen ahead of you are the partner council projects that we've been working on. And in each of these instances, we will be putting together a case study to explain how public patient involvement and engagement has been advanced either through network development or through events and activities that question and draw out, a diversity of voices as we think about particular topics. So we will be sharing these examples with you, and I won't go through them all, but just to say that as our partners have engaged us, we've aimed to be responsive and to either provide financial support or, as I said, those in-kind technical assistance supports. Just up on the screen are a number of examples of the different sorts of workshops and networking events that we've been involved with through different partners and organizations over the last 2 years, both here in Ireland and in Spain. And then a lovely example, this is Michael Foley working with Alzheimer's Society of Ireland and their Dementia Research Advisory Team. And if you haven't, do go to the Alzheimer's Society of Ireland, check out their website. They have lovely resources and a really nice story that they're beginning to tell around how they are evolving in this space. So a lot of learnings for all of us. As we set out to do our progress report, we had a moment of reflection and we just took a look at the vision statement that we had for Ignite when we got started and thought, look, how are we doing? Just in terms of gut feeling, at least 3 stars showcasing some demonstrated progress, more than a few examples to showcase that things are moving in the right direction. 2 stars was around a growing body of evidence. Again, it may not be completely embedded, but it's nice to see that we're moving in the right direction. And then 1 star would be where we have some examples. They may be anecdotal, and we probably need some research on the research to get a sense of what's happening in that space. I won't read through them all, but I'd ask you to do the same thing and get a sense of, in your own areas and in your own teams and on your own projects, how are you doing in this space? So from an Ignite perspective, we are seeing ample evidence of these things. It's the sustaining of them and the evolution of the opportunities that I think we're really interested in. And so if we are successful with phase 2 of Ignite and that funding proposal has gone into the Health Research Board and Irish Research Council, then we will be looking at specifically impact assessment and the quality of PPI approaches. And so we hope to continue to measure progress against this vision. I'm really pleased to say that in July of 2020, the Office of the Dean of Research invested in the development of a research impact unit. And in many ways, this had to do with some of the recommendations emerging from the Ignite program around the types of supports, especially in those award categories that researchers needed. So this investment by the Office of the Dean of Research funded a director of the Research Impact Unit and 2 research impact officers, 1 in Trinity Longroom Hub and 1 in the School of Medicine. So I'm delighted to say that I'll be leading out on that pilot project over the next 2 years, and the investment by college in this initiative has allowed us to bring on Michael Foley full-time as the project manager for Ignite. So I'm sure many of you have worked with him and know what a great opportunity this is for the Ignite office, but also truly as we transition from phase 1 into hopefully phase 2 activities, there will be a growing emphasis on methodologies and around quality and research on research. And it's really nice to have someone in place and at the helm alongside Professor Mary McCarran, who can work on those projects aligned with the phase 2 application. So Michael will be in touch with you shortly to reach out and to schedule an Ignite team call. And that's the purpose of this video, is to give you an update here so that you can really talk about the opportunities associated with the end of this project and the transition into phase 2 of Ignite. We were able to use that investment by the Office of the Dean of Research as part of our leverage for the phase 2 application. And so again, it's demonstrating that, institutionalized and sustained infrastructure that we're hoping for when it comes to advancing public patient involvement in research. So in terms of what's left to do in the last 3 months of this project, well, we're going to continue to offer supports to researchers, and that will continue to be ongoing. But we have 4 projects that we are advancing. The first is an Ignite module on maximizing research impact through public patient involvement. And while we had committed to a module and we've embedded PPI Ignite within 2 modules within Trinity, we felt that this was a nice opportunity to consolidate the resources and the training developed over the last few years and to create some how-to guidance for researchers. Michael is working with TUSLA on a PPI Ignite ethics brief, and that will continue to advance in December and January. We will be reaching out to each of you with a PPI Ignite case study template and encourage you to fill that out, and we'll work with you to effectively tell your story. And then our last set of events will happen during EU Researchers Night. This is Start 2020 in November. And we're really pleased to showcase this tent of bad science that the Ignite office is advancing in collaboration with the Office of the Dean of Research. And the goal here is to really look at science communication, how we talk about research, and especially how we present ideas in an era of fake news. So really a set of exciting and interesting events. I will attach the flyer to the email so that you can have the hyperlinks to register for each of these, but a really nice opportunity for us to think about who's included and who's excluded as we have conversations around research. As I mentioned, Michael will be in touch. He's going to send out an email to each of you, a follow-on email to set up the next Ignite team meeting. And those opportunities to continue to collaborate will be presented, the module, the ethics brief, and the case study template. But Mary and Michael will also present the phase 2 ambition and the details from the application that was submitted to the Health Research Board and Irish Research Council. So I hope you found that presentation useful. It's been a delight to work on the project, and on behalf of Mary, Michael, and myself, I just want to say thank you for the inspiration, the great work, the opportunities to continue to work together. And should you have any questions, please don't hesitate to reach out to any of us. We're all excited to continue on this PPI journey. Mind yourselves, take good care.